Everything you need to know about acid reflux and GERD. Gastroesophageal reflux disease, GERD, is a chronic and more severe form of acid reflux. Causes and risk factors include overeating and pregnancy. Most people can manage their symptoms with lifestyle changes or medications. Acid reflux happens when contents from your stomach move back up into your esophagus. This action is also called acid regurgitation or gastroesophageal reflux. If you have symptoms of acid reflux more than twice a week, you might have a condition known as gastroesophageal reflux disease, GERD. The condition is a more serious and long-lasting form of acid reflux. Most people can manage GERD with over-the-counter, OTC, medications and a few lifestyle changes. GERD symptoms. The main symptom of GERD is acid reflux. Acid reflux can cause an uncomfortable burning feeling in your chest, which can move up into your neck and throat. This feeling is often known as heartburn. If you have acid reflux, you might develop a sour or bitter taste at the back of your mouth. It might also cause the regurgitation of food or liquid from your stomach into your mouth. Some other symptoms of GERD include nausea, chest pain when swallowing, difficulty swallowing, chronic cough, hoarse voice, bad breath. The problem with home remedies for GERD. Some individuals might prefer to start with home remedies to treat their heartburn. While certain home remedies may help a little when it comes to occasional bouts of acid reflux, if you've been diagnosed with GERD, you're most likely dealing with a chronic issue. Chronic health issues can sometimes be eased by lifestyle changes, but also typically need some kind of medical intervention. When it comes to chronic issues, it's best to resist the desire to self-diagnose and self-medicate. Talk with your doctor before starting any new treatments. A few home remedies floating around out there that may do more harm than good include drinking a baking soda and water solution. Because baking soda is alkaline, it has the ability to help neutralize acidity, and is mostly safe to consume in small doses. But baking soda is high in sodium, and it's also possible to experience side effects if you consume too much. Chewing gum. The thought here is that because saliva is slightly alkaline, stimulating it by chewing gum after eating may help neutralize the acidity in your mouth and throat. Consuming ginger. Ginger is a common home remedy for issues like nausea and a sour stomach, but it's still unclear if it can actually help with occasional heartburn symptoms. In fact, in many studies' trusted source, heartburn is a symptom of taking too much ginger. Drinking milk. Due to its natural alkalinity, milk is another home remedy that's often touted as a way to ease heartburn symptoms. Unfortunately, even though it may feel soothing initially, the fat and protein it contains can ultimately make heartburn symptoms worse once the milk is digested. Low-fat milk may be easier for some people to tolerate. If your doctor suspects you might have GERD, they'll conduct a physical exam and ask about any symptoms you've been experiencing. Your doctor may then recommend you to a gastroenterologist, or may conduct certain tests themselves, including ambulatory 24-hour pH probe. A small tube is sent through the nose into the esophagus. A pH sensor at the tip of the tube measures how much acid exposure the esophagus is getting, and sends the data to a portable computer. Esophagram. After drinking a barium solution, X-ray imaging is used to examine your upper digestive tract. Upper endoscopy. A flexible tube with a tiny camera is threaded into your esophagus to examine it and collect a sample of tissue, biopsy, if needed. Esophageal manometry. A flexible tube is passed through the nose into your esophagus to measure the strength of your esophageal muscles. Esophageal pH monitoring. A monitor is inserted into your esophagus to learn how acid is regulated in your body over a period of a few days. There are multiple types of surgery available to treat GERD, including fundoplication, during which the top of your stomach is sewn around your esophagus, and bariatric surgery, usually recommended when a doctor has concluded that your GERD may be exacerbated by too much excess weight. It's important to note that there's a very real distinction between occasional heartburn, which may not need medical intervention, and GERD. Most people experience heartburn from time to time, and in general, occasional heartburn isn't a cause for concern. But if you've been experiencing heartburn more than twice a week, and especially if you've also been experiencing a chronic cough and chest pain, you might be dealing with GERD. The lower esophageal sphincter, LE, is a circular band of muscle at the end of your esophagus. When it's working correctly, it relaxes and opens when you swallow. Then it tightens and closes again afterward. Hiatal hernia. This is when a part of the stomach moves above the diaphragm towards the chest area. If the diaphragm is compromised, it can increase the likelihood that your LE can't do its job correctly. Frequently eating large meals. This can cause the distension of the upper part of the stomach. This distension sometimes means there isn't enough pressure on the LE, and it doesn't close properly. Lying down too soon after large meals. This can also create less pressure than the LE needs to function properly. There's no one cause of GERD, there are lifestyle choices and certain health factors that can make a diagnosis more likely. These include living with obesity, being pregnant, living with a connective tissue disorder, smoking, frequently eating large meals, consistently lying down or going to sleep shortly after eating, eating a lot of certain types of foods, like deep-fried or tomato products, drinking certain types of beverages, like soda, coffee, or alcohol, using an abundance of non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin or ibuprofen. Some people who've been diagnosed with GERD find that certain foods and beverages can trigger their symptoms. While triggers can be very personal, there are a few foods that are routinely cited as more triggering than others. They include anxiety and GERD. According to research from 2015 trusted source, anxiety and heartburn can be connected. When one increases in severity, the other might as well. It's also possible that individuals living with heartburn or GERD are more anxious because living with the condition can produce unwanted symptoms. If you suspect that anxiety is making your symptoms worse, consider talking to your doctor about strategies to relieve it. Pregnancy and GERD. Pregnancy can increase your chances of experiencing acid reflux. If you had GERD before getting pregnant, your symptoms might get worse. Asthma and GERD. Asthma and GERD often occur together. Trusted source. While more research is needed to understand the exact relationship between asthma and GERD, it's possible that GERD might make symptoms of asthma worse. Additionally, asthma and some asthma medications might increase your risk of experiencing GERD. IBS and GERD. Irritable bowel syndrome, IBS, is a condition that can affect your large intestine. Common symptoms include abdominal pain, bloating, constipation, diarrhea. If you have symptoms of acid reflux more than twice a week, you might have a condition known as gastroesophageal reflux disease, GERD. Thank you for watching.